All right, welcome back. Hope you're all having a great weekend. Today, we're continuing our BCBA exam practice question series, where we're going through a set of practice questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, please check out BCBAstudy.com. We offer 3 practice exams, a task list study guide, and our combo pack. As always, questions, comments, let us know. Work hard, study hard. Let's get to our questions. Question 1. A team of researchers at Kansas University are thrilled after analyzing the data from their most recent experiment with infants and toddlers. However, one member of the team is questioning whether their independent variable changed the behavior of the infants and toddlers. The member is worried about what dimension of ABA. Now, ABA dimension questions. 7 of them. We need to know them all. And when you're answering these questions, there's often going to be 1 or 2 that look right. Okay. So you have to remember, we need the best answer. And within the question, there's going to be 1, 2, maybe a phrase that identifies exactly the dimension you're looking for. This is why we always preach. You have to do all your work in the question, especially for these types. Because if you read the question quickly and then jump to the answer choices and just try to guess and figure it out, it's just not going to work out. So you have to do all the question up front. With that said, let's look at it. Right? Because we're looking at the member, okay, and assuming they're talking about the member of the team who is questioning whether the IV actually changed the behavior of infants and toddlers. So, what is that member actually saying? Well, he's actually questioning, is there a real functional relation? Do we actually have experimental control? Because if our independent variable didn't change the behavior, something else did, and we would lack that experimental control. So, if the member is worried about experimental control or a functional relation, what are they worried about? Are they worried about A, being conceptually systematic? We don't know anything about the intervention they used. We don't know if they were conceptually systematic, if they weren't, there's no information there. So we can't reliably say A without more information. B, analytic. Well, this is what we're looking for, right? The member is worried about being analytic. He wants to make sure they have experimental control and that there's a functional relation. If their IV is not affecting the behavior, they're not adhering to the dimension of analytic. Do we pick B and move on? No, we read all of our answer choices. So C, applied. Applied focuses on meaningful change, meaningful behaviors that are going to impact the client and the stakeholder's life. We're not sure what the behaviors are. We can't say for sure whether or not it's applied. And then in behavioral, we are looking at behaviors and defining them objectively, measurably. We're focusing on the observable, the measurable, right? Again, not sure what the behaviors are, not sure if they're meaningful, not sure even what concepts they're using, but we do know the member is worried about being analytic. Typically, you wait until the day before to complete your assignments, but next week, your friend is coming in town and you know you won't be doing any schoolwork. You end up finishing all your assignments for the current week and next week. Your friend, blank. Okay, let's work our way through this question. Who are we focused on? We're focused on the friend. And what is the scenario describing? Well, we know typically you wait to complete your assignments. Okay, so let's say you see an assignment, you do your assignment, consequence is finishing your assignment. And that chain, so to speak, doesn't typically, or that contingency typically doesn't happen until the day before. But this time, your friend, who we're focused on, is coming in town. All of a sudden, you finish all of these assignments for the current week and next week. What changed? Well, the consequence of finishing your assignments has changed, right? The value of finishing your assignments has changed. Your behavior has temporarily changed. Are you going to complete your assignments this way in the future? Maybe, maybe not. But at least temporarily, your behavior has changed because the value of completing your assignments has also changed. So your friend altering your behavior and the value of a consequence functions as a motivating operation, right? Now, if you look at A, B, and C, MO, motivating operation, is not an option. Instead, we're getting a little more precise. So A, an establishing operation. An establishing operation increases the value of a consequence. Well, your friend increased the value of completing assignments, right? The consequence for completing assignments went up in value. Your friend is an establishing operation. Do we pick A and move on? Don't. We'll read all of our answer choices. So B, an abolishing operation. Can't be establishing and abolishing. And since we know it's an establishing operation, it can't be B. C has an evocative effect. Now, remember, MOs typically establish or abolish, and then evoke or abate. Okay, so they have value altering and then behavior altering. So the value is altered and your behavior is altered as well, right? Because typically you wouldn't do all your assignments ahead of time. Temporarily, though, because of your friend, you did. So your friend had an evocative effect on this behavior. So not only did it alter the value of a consequence, it also changed your behavior. So your friend actually functioned as an establishing operation and had an evocative effect. So your friend is D, both A and C. Got to read all of your answer choices, especially when you're studying. Explain not only why the right answer is right, but why is the wrong answer wrong. Thinking through these things, applying yourself is going to make you better at the exam. If you wanted to increase the effectiveness of a shaping procedure targeting a client's ability to mop the entire floor of their house, what would likely be most effective? This is a very specific, precise question. Okay. And sometimes I like to ask these specific, precise questions because on the exam, you might see a very specific, precise question that you might only know through luck. And what I mean is there's so much information, Cooper, and all of our materials, that sometimes questions you might just not cover. Okay. So this is in Cooper. What can increase the effectiveness of a shaping procedure? So let's talk about it, right? We want to increase the effectiveness of shaping client's ability to mop the entire floor of their house. So what's going to be most effective? A timeout procedure for failing to mop the entire floor. Well, shaping procedures do what? They increase behavior, right? We're trying to increase mopping. A timeout procedure is a punishment procedure looking to decrease. It doesn't add up, right? So A is out. B, offering instructions and other prompts during the shaping procedure. Yes. Now, in Cooper, to increase the value, increase the effectiveness of a shaping procedure, we can offer up prompts and instructions and that sort of thing. These increase the effectiveness of shaping. Again, you might have learned everything there is to know about shaping and you missed this one thing because there's a lot of information on shaping. It happens, right? So what we're trying to do is expose you to as much as possible. Now, what about C? Reinforcing the client only once the entire floor is mopped. Is that a shaping procedure? Not. When do we reinforce in a shaping procedure? Each successive approximation, right? Not just at the end, but we're reinforcing bits and pieces of the final behavior, right? The terminal behavior target. And then D, teaching the client to man all done when they don't want to mop anymore. This would be a good functional communication training objective, but teaching them to man all done when they don't want to mop is not going to help them mop the entire floor. So we have to remember our goal and keep that in mind. So if we want to increase the effectiveness of a shaping procedure, we are going to start offering instructions and other prompts during the shaping procedure. A team of 3 RBTs and a BCBA all work together on a client who receives services every day of the week. The client is fun to be around and engages well with all staff except one RBT. Whenever the client sees this RBT, he will shout no and close his eyes. How might you explain this to the client's parent? First things first, if you have to answer a question about explaining something, immediately, what do you think? Well, you think avoid jargon, avoid technical language, and just explain it in terms they can understand, while also respecting you don't want to make your team look bad, right? This is a collaborative effort. Maybe the RBT did make a mistake. We're not sure, but maybe they did. We don't want to throw our RBT under the bus because what happens is the client and the stakeholder loses faith in that RBT and services suffer. Okay, we're a team. We need to protect our team. Now, in this case, we have a team of 3 RBTs, and the client is fun, engages well. We all know this type of client. And then there's one RBT they see, shout no, and close their eyes. So what they're essentially trying to do is what? Well, escape from the RBT, we can assume. So how are you going to explain that to the client's parent? A, since we use a punishment procedure, the RBT might now function as an aversive to the client. Not a bad explanation if we're talking to the team, but what's wrong with this for the parent? Well, it's a little too technical, and it might paint the team in a bad light, right? Okay, well, what is the punishment procedure? What does it mean to be aversive? How bad is that? It's not something easily understood by a parent who's wondering why their client or their son or daughter, whoever it might be, doesn't want to be around this person. Okay, so A is not going to cut it. B, the RBT's presence functions as negative reinforcement for the client and maintains the behavior. Now, one, too much jargon, okay, way too technical, way too formal. But two, does the RBT's presence function as negative reinforcement? Well, no. The RBT leaving or the client getting away functions as negative reinforcement. Escape functions as negative reinforcement for the client and maintains the behavior. So B isn't even describing accurately what's going on. C, the RBT needs to build more rapport with the client, so we might incorporate more play into session for now. Okay, that's pretty good, right? We're going to build up relationship. We're going to build rapport. So we might have this RBT play more for now. They can understand that, right? It's very, very common language. Makes sense to just about anybody. It's easy to explain. C looks pretty good. And then D, the function of the client's behavior is escape. We are going to use a differential reinforcement procedure to reduce the behavior. The first part's not bad. We're doing it for escape. But then we talk about differential reinforcement procedure. Okay. Again, a little too technical. To us, it's not. Okay. But when you talk to somebody who has no idea what ABA is or how it works, differential reinforcement means nothing to them. You have to remember that. We're not talking for us. We're talking to a certain audience who doesn't know what any of these things mean. And you have to remember that, and you have to respect that. So if you're going to explain the situation to the client's parent, C is going to be your best bet. Your RBT needs to build more rapport with the client, so we might incorporate more play into session for now. John manages the special education program at 3 different schools. He employs a BCBA for each program. He wants his BCBAs to start using behavior skills training in their programming. He sends them a 10-minute video on behavior skills training and asks them to train the other staff on it. What is the issue here? This is an ethical question straight from the ethical guidelines. I always try to make ethical questions straight from the ethical guidelines. That's what they're going to test you on. They want you to know the ethical guidelines front and back, black and white. Okay. So what is going on here? Well, we know John manages a special education program and he has a BCBA. So they are supposed to adhere to the BCBA code. Remember, BCBAs and BCABAs adhere to the ethical code. Nobody else has to go by our ethical code. Teachers, their other therapists, parents, nobody, just BCBAs, right? So he wants his BCBAs to start using BST in their programming. He sends them a 10-minute video on behavior skills training and asks them to train. Is a 10-minute video on an intervention enough to make you competent to train on it? It's not, right? By any measure. 10 minutes is not enough to make you a good trainer for what is going to be incorporated into this program. So that's the immediate issue that jumps out. So A, behavior skills training is not conceptually systematic. Well, it is, and it can be. And again, there's not enough information here to justify picking this answer. If you're going to pick an answer, make sure you can justify it given the question. All we know is he wants them to use BST. We don't know anything about it based on the information given, right? And remember, we're only using the information given, not past experience, not our experience, not what we know, just the information given. Make sure you can justify your answers based on what you're given. B, behavior analysts should not train on something they are not competent in. Yes, this is what the ethical code says. Only train, only work on, only work with within your scope and what you're competent in. 10 minutes is not enough to give them the ability or the competence to train other staff on something they want to implement in programming. Just not ethical. C, John is not a BCBA and should be supervising other BCBAs. Should not be supervising other BCBAs, as you said. Regardless, do we know if John is the BCBA? We have no idea. And that's why I put C in here. Okay. So it said it should be should not, but either way, we have no idea. We just know John manages the program at 3 different schools. Do not assume anything. Only use information given. It doesn't say he's a BCBA, but it also doesn't say he's not. Okay. So C is out. And then D, BCBA should train staff outside of ABA practitioners. They can, right? That's not really the issue here. Okay. Should they? Maybe it just depends on their job and what they're doing, right? D is not really relevant. Okay. If a BCBA is employed or contracted by a school, they're free to train whoever the school lets them. The issue is they're not competent. Okay. Don't get distracted by these other answer choices and stick to what the question is asking. And what is the issue? The issue is they're not competent enough to train, regardless of who they're training, regardless of who's supervising them. The BCBAs are not competent enough to conduct this training. That is the issue. A teacher wants to shape one of her students' reading behavior. The student currently reads 70 words per minute. The most she has ever read is 85 words per minute. Target for the year is 90 words per minute. How should the teacher design the shaping procedure? So this question is in regards to what is our shaping procedure going to look like? Where are we going to start? And how much are we going to increase each approximation? So we know that the student currently reads 70 words per minute. The first thing first, we're never going to start shaping below current level. Okay, we want it at least at current level, and really higher. They can already do 70 words per minute. So our next goal needs to be up. Okay, so if we look at our answer choices, A, the teacher should reinforce at 65 words per minute. Well, that's below what they can already do. So A is out. Now, the most she's ever read is 85 words per minute, and the target is 90 words per minute. So not only should we start above the current goal, but it should be a reasonable amount above the current goal. So if we look at D, teachers should start at 80 words per minute. That's a 10-word gap to start off. It might be a really, really long time before they get there. And remember, with shaping, you're only reinforcing that next approximation, right? That's where we're trying to get. But 80 is going to be too high. So let's look at B and C. B, the teacher should reinforce at 73 words per minute and then add 3 words to the goal each step. This looks perfect, right? Our starting point is 3 words above what it is now, and then we're adding just 3 words to the goal each step. So it's a reasonable amount of increase, right? And it's a reasonable starting point. C has a reasonable starting point, but again, 10-word jumps each time is going to be too much. So remember, when designing shaping procedures, let's pick a starting point just above where they're already at, and then make sure our increases are reasonable. So in this case, the teacher should reinforce at 73 words per minute, and then add 3 words to the goal each step. The clinical director of an ABA company always recommends the maximum number of hours whenever she does a client assessment. She employs 4 of her BCBAs who rotate taking cases. BCBAs often think their clients are getting too many hours. Should they take action? Should they take action? Now, BCBAs are oftentimes put in difficult ethical situations, and this might be one of those. Okay, you work for a clinical director doing all the assessments, and she's employing you and making you take cases, right? And she's always saying we need the maximum number of hours for every client. Well, that's a problem, right? Because we are supposed to recommend an appropriate amount. Okay, so that could be 5, 10, 15, 40, not just a standard of everybody gets all the hours. So does that fall on the clinical director or the BCBAs? Well, it's the clinical director's fault, but the BCBAs, if they take the cases and don't say anything, are complicit. You have to act, right? So what should they do? Should they take action? A, no, they should trust their clinical director to make the right decisions. They should trust their director, but they need to take action if they think the hours are inappropriate. B, no, the more hours the better for clients who need services. Not necessarily, right? It's not a one size fits all model. Be individualized. C, yes, the BCBA should be referring these clients to other companies. No, we just need to be recommending an appropriate amount of hours. And then D, yes, BCBA should advocate for the right amount of treatment for clients. Yes, from the ethical code, we always advocate for the right and appropriate amount of treatment. If the clinical director is recommending this one size fits all approach isn't appropriate, and the BCBAs need to take action and either, well, first, they need to talk to the clinical director. If it isn't resolved, then they can escalate it up to the board. Should they take action? Yes, BCBA should advocate for the right amount of treatment for clients. Bill has anxiety and will bite his nails. He is attempting to decrease the number of times he puts his fingers near his mouth while in public. What type of measurement should he use to achieve the most accurate results? All right, pretty simple measurement question. What's tricky here, okay, is this idea of accurate results. Okay, so what type of measurement should he use to achieve the most accurate results? And when we think about measurement, continuous, discontinuous, and permanent product, of those three, which is most accurate? Of course, continuous. So that means we need to eliminate any discontinuous measurement that might not fit. If we look at our answer choices, partial interval is gone because there is a continuous measurement procedure that's going to work here. Second, what are we trying to decrease? Trying to decrease the number of times he puts his fingers near his mouth. So if we think about this behaviorally, okay, if he does it 10 times per minute, we could decrease rate. Rate's not an option. So we need to move to the next option. Well, if he's doing it 10 times per minute and there's 10 seconds in between, if we can increase the time in between behavior, we can decrease the amount that's happening, right? So if we're going to change the time in between behavior, what are we targeting? Are we targeting duration? Not duration. Duration is the length of one response, right? Start to finish. Latency. Latency is the time in between the SD and the response. It's going to be inter-response time. Inter-response time is the time in between response 1 to response 2. So putting his fingers near his mouth while in public, right, is our response. First time, second time is our inter-response time. If we can increase that time, we can start to decrease his behavior of putting his mouth or fingers near his mouth in public. All right, thank you so much for watching. Please check out, I should say 44. Please check out bcbastudy.com for all of our study materials. As always, work hard, study hard. See you soon.